Lauren DeMarco is live tonight outside of the White House, where there is a protest set to get underway tomorrow. Lauren.
Well, Sarah, imagine being in your first year as an ER nurse and COVID-19 happens. That was the case for one woman in Loudoun County. We spoke with her tonight, and she was saying that because COVID-19 is what everyone is talking about these days, the built-up fear over it is making it that much more difficult for people when they're diagnosed.
You combine like stress and anxiety with the feeling of not being able to breathe, and your whole world just seems to be like.
Virginia Walker says her heart goes out to the frightened COVID-19 patients walking into the emergency department. She described what she's been seeing at a Nova Loudoun hospital right now.
So maybe not as many new cases, but there's complications from positive cases that were okay at home quarantining that are now not okay.
Walker is a first-year ER nurse, and after just 3 days of training for the ICU, she's gearing up for her very first shift there tonight.
And to me, I'm like, man, I'm not even a year under my belt as a baby ER nurse. I'm just learning, like, when there's a need, you just learn and you adapt.
Skills she learned early on because immediately after graduating Cedarville University in Ohio, she served as a missionary in the Congo.
This is shocking to every American. This is all over the news. But this was like Congos every day. It was just, they're like, oh yeah, I lose half my kids to malaria by 5. That's been their reality in their country. And so I think in some sense it's just brought, I hope that it's brought this like thankful perspective of life is so important and health is so important, but it's not something that's guaranteed.
She says she feels honored to help people at their most vulnerable moments, from those who are separated from family to those who are intubated.
Chat with them or just talk to them, even though they can't really talk back, they can hear. And when people can't have family in there, and it's learning to be unique with ways of like playing tic-tac-toe on the sliding door, since you can't really be in the room and hang out with them if it's a younger person, or FaceTiming in mom and dad or their kids so that they can say goodnight.
Walker says she is blown away by all the support for healthcare workers. She is grateful to be helping on the front lines, even though it comes with risks. And she is hoping that we come out of this pandemic even stronger.
In some ways, I pray that it's just like a good reset on just priorities and what's important, what do you value, and how to value everything well.
Now, Walker says that she has never had to go a shift without access to PPE, but again, tomorrow, other nurses from National Nurses United will gather here because they say that it has been a concern in many areas nationwide. They're going to try to call for some more support for nurses, and they're also going to place a pair of shoes for each nurse who has lost their life to COVID-19. Back to you.